Well, hello, my name is Michael Jolly. I'm a cardiologist from Columbus, Ohio, and it's a great pleasure to get to speak to you all digitally this year for the Cardiovascular Innovations Scientific Meeting. My topic is This is what I want from my podiatry colleagues. So we all know that what we see in clinical practice is often just the proverbial tip of the iceberg with regards to prevalence of vascular disease. And it's worth noting that there are many subspecialties out there that can really help us identify a great or vast many more patients with these diseases, and podiatry is certainly one of those. For one, they're one of the few specialties out there that actually look at feet, which is often the very first clinical indication of vascular disease when it rears its ugly head. The care of the critical limb patient is really multidisciplinary. And this is kind of depicted by this multi-Venn diagram figure. But I would suggest that the three main pillars of care involve the patient's primary care physician, the vascular physician, and really podiatry, because podiatry is where a huge portion of these patients either are identified or ultimately go for their destination long-term treatment. So a little bit about podiatric medicine. It's worth noting podiatric medicine is a very complicated field. There's 4 years of undergraduate degree in the United States, followed by 4 years of podiatric medical school. And then everyone goes on to a 3-year residency where they go through all the different disciplines involving podiatry. And a few will actually go on to take a 1-year fellowship. This is optional, and those fellowships can be in things such as trauma or geriatrics. I've highlighted wound care because it's relevant to this talk, but others can go on to do things like reconstructive foot and ankle surgery. Well, what I want most from a podiatric surgeon is communication, and really this is the underpinnings for all of clinical medicine. Good communication is foundational for good patient care. But somewhere along the way, we've really all lost this message. Well, this is very important when you're talking about wound care because time clearly is of the essence. It's worth noting that we really need to consider modernizing the way we communicate. If your practice relies heavily on performing a consultation and faxing your consultation report to your referring physician, then I would suggest that you're really stuck in probably clinical practice from 2 decades ago. And admittedly, many of us still are. But when it comes to wound care healing, I would strongly suggest that you consider communicating, especially with your podiatrist or wound care surgeons, with a much more modern way. And that may be something as simple as texting. Of course, we always recommend using HIPAA-compliant texting apps. Epic Haiku is one that now you can capture clinical images of patients. And if you can't do that, then having a good foundational relationship with the treatment team and your podiatrist can be achieved by phone calls. The most important concept here is that you need real-time communication because you have to be able to pivot quite quickly when the clinical need demands such. Communication among the vascular physician and the podiatrist should be honest and very open, and it should flow in both directions. I like to tell podiatrists, if I can give the patient perfect blood flow to their limb, which of course is not always possible, can you heal this wound with your wound care expertise? Or if you're going to do a minor amputation, do you have enough healthy tissue to close, say, a transmetatarsal amputation? I would like to know that up front before I spend 3 or 4 hours piecing together a bunch of tibials, only to know the whole time you felt this was not salvageable. Other things I'd like to know is what concerns do you have from the wound care or operative perspective that I can help you with? Does the patient show up to see you in clinic? I mean, is this a reliable, adherent patient who's going to comply with instructions? It's worth for both of us to know that up front so we can make our general clinical recommendations. And finally, are you comfortable as the treating podiatrist with modern wound care techniques, or is this not something you're really adequately trained for? If not, can you refer to someone who can? Basic understanding of wound care, especially as it relates to critical limb ischemia, is imperative. And I would suggest to podiatrists not to assume that your vascular physician for example, me, I'm a cardiologist with very little training in wound care, really understands all the nuances and subtleties of wound care in the modern setting. But I would expect a treating podiatrist to know the basic differences of arterial versus venous wounds, to know the pathophysiology or how urgent referral to someone like me for revascularization might be, when a patient should be admitted to the hospital. And also, really knowing their own limitations of their practice. And if they have a wound that needs perhaps a split thickness skin graft by a plastic surgeon, or maybe they need hyperbaric oxygen therapy, do they have access to making such referrals? Now, one of the things I like most from my referring podiatrist is their antennas are always up for other markers of vascular disease. So they come across swaths of patients who have prior history of AAA or carotid disease, or maybe prior ischemic wounds, history of DVT, who are just simply not being followed. And a podiatrist like this is an excellent resource for referral to a physician like me who can actually manage these patients chronically and potentially even steer them away from having these diseases happen again. But of course, this is primarily a talk related to critical limb ischemia, and the ability to diagnose and refer patients with PAD for appropriate treatment is imperative. It's worth noting that anyone who is treating or diagnosing peripheral artery disease probably already knows why it's so important, and that is it's right in line with many cancers in terms of overall survivability and mortality. In fact, patients with PAD, and we've known this for many years, have a much truncated lifespan compared to those who don't. And the survivability of patients with PAD decreases as the severity of their disease process increases. I really like when podiatrists obviously can recognize the signs and symptoms of PAD, and most podiatrists can do this. However, the really, really clinically in tune podiatrist for wound care often will pick up the subtle signs of vascular disease well before it becomes a problem. So they may be seeing the patient for, bunions or a broken toe, whatever the case is, and ask them, can you walk to your mailbox? Or are you having signs and symptoms of claudication? Do you have erectile dysfunction? And these are all the very subtle things that are nice to get referrals from podiatrists on well before they become a problem clinically. So, I have the luxury of working in a healthcare system where we have almost the perfect situation. We have a comprehensive critical limb center and wound care center. This is a single-stop shopping where we have on-site comprehensive vascular testing, hyperbaric oxygen therapy, a full-fledged wound care center, vascular consultation throughout the entirety of the day, and something somewhat unique, we have every patient who is coming in for a wound gets a global cardiovascular health assessment by our cardiovascular nurse practitioners. So patients get this health assessment. It helps us get them on guideline-directed medical therapy and hopefully even change their overall mortality as it relates to cardiovascular disease. And here's a picture of our nurse practitioners who very thankfully perform this often very busy task during the busy clinical day. So, in summary, I would suggest a strong relationship between a vascular specialist and podiatry is paramount for clinical success in terms of healing wounds and managing vascular disease. Podiatrists are at the front lines. They're often the first and sometimes only doctors who can recognize underlying vascular disease, and getting patients referred and initiated on the right clinical treatment can dramatically improve the overall longevity of the limb and really the overall longevity of the patient's life. Thank you very much.